Hello brain checkers. Today we're going to be looking at the physiological changes that happen within the cervix and the vagina. Now, the cervix and the vagina are part of the reproductive tract. Now, within the cervix, you will understand that the cervix basically is a hollow structure that is formed and is a connection of the uterus, which is the main body of the uterus, to the parts of the vagina. Now, the structure itself is about 2, 3 or 4 centimeters long and forms a hollow structure in between it. Now, this hollow structure that is formed within the cervix or connecting the cervix, the vagina to the uterus, in most cases, it has cells within its lining known as the endocervical cells. Now, those endocervical cells also are adjacent to so many glands that then have the capacity to produce a lot of mucus that is under the influence of hormones. Now, when the endocervical cells have then been stimulated to produce mucus, they do produce mucus that could be thin and mucus that will thicken. So around the time when one is ovulating, they will produce a thin type of mucus, and this is why, to allow the spermatozoa to then be able to penetrate and be able to fertilize that released ovum. But when pregnancy has then been achieved, what is going to happen is that the endocervical region or the endocervical cells are going to produce a more viscous and thick mucus. Now, this mucus that is going to be formed will come in and form closure on the canal. So it forms a closure or a plug within the canal, and this plug is what we're going to refer to as the operculum. Now, the operculum tends to be passed out when one is about to get into a stage of labor, and this is because of the cervical effacement, which is basically just the taking up of the cervix to become part of the lower portion of the uterine cavity during the stage of labor. Now, that pulling or taking up of the cervix then reduces the length of the cervix, and also the dilatation aspect will then facilitate the loss of that operculum. And because it is attached to the borders of the cervix where you have terrestrial blood vessels there, it may come out as blood tinged and may be referred to as a show that has then been passed, and that would be one of the signs that would be indicating that possibly this woman is almost going into a stage of labor. Now, you understand that during the stages of pregnancy, there will be a number of changes that will happen to the cervix. The color as well may change of the cervix, and within the cervix, if it begins to appear a little bit bluish, that's because of the blood supply that has been increased to the area, and that's called a Chadwick's sign, the bluish discoloration that is going to happen to the cervix. So basically, that is what is happening around the cervix. Then when we come to the vagina, so the vagina is just a connection of the cervix, and then you have a posterior aspect, you have lateral aspect, and you have an anterior aspect, and it forms fornices around the cervix. So there is some form of protrusion of that cervix into the vagina. Now, within the vagina, you have the vaginal epithelium. Now, the vaginal epithelium has what is going to allow it to then shed and release some of those cells under the influence, obviously, of the hormones. And when they shed and release some of their cells, that is what we are going to see as a whitish discharge. Now, this whitish discharge that we call leukorrhea is a normal discharge. Okay, so you need to be able to differentiate also a normal discharge from an abnormal discharge. So if it appears a bit grayish towards white grayish, then it could be an indication that you are dealing with another condition, which could be a bacterial vaginosis. And if it appears a little bit yellowish, then we are kind of thinking, okay, could this be a yeast infection that is actually setting in? So those are very common, especially in pregnancy, but then you need to look at the type of discharge as well that is coming in. If it is just a normal whitish discharge. It tends to increase in amount depending on the amount of hormones as well that are coming into and that are being stimulated and how high they are. So it means that that also increases the amount of discharge that one would be passing. But if it is odorless, it is just a normal whitish discharge, that is absolutely normal during the stage of pregnancy. It is the vagina kind of washing itself out, getting rid of those cells and removing them. And now the vagina is an acidic state. Okay, and all this is actually created because of the lactic acid that is coming in, and you have organisms in there that are normal flora, such as the borderline bacillus, the lactic acid or bacillus as well, in the vagina. They're giving you a pH of somewhere around 3.5 to about 4.5, and that is why when you have that discharge as well, the discharge that is emanating from the vagina as well has the capacity to stain and change the color of any underwear that is worn. So it's because of the acidity that is there. The acidic state of the vagina is basically to try and create an environment that is then safe going upwards, meaning that any other pyrogens or organisms that then gain access to the vagina will be denatured by the acidic state. But some of them that are capable of operating well in a state that is acidic will then gain access and can cause infection. So it is important to be able to differentiate the type of discharge that one is having. So the vagina will also receive some form of supply from the cervix. That is, some of that mucus as well is going to come through into the vagina. And you also notice that within the lining of the vagina, there will be kind of bridges that will be there that we bridges that allow some form of extension and distensibility during sexual intercourse and during the process of childbirth. And those bridges or folds, we call them rugae. So they actually help in the distensibility of the vagina itself during those processes. So basically that's what happens in the cervix and the vagina. So do look out for more as we look at the other systems that are affected during the stage of pregnancy. And don't forget to subscribe to the YouTube channel. It's the Brain Shakers Academy. Follow me on Facebook as well, the Brain Shakers Academy. Drop me comments in the comment section. I would like to hear what you think, and I would like to hear some of your input as well. And thank you so much for watching and the support, and I will see you definitely in the next one.